All right, the health care law has been a bitter pill for voters and many Democrats to swallow, polls tying the midterm shellacking directly to the law. But as Tevi Troy writes, health care has been giving Democrats a hard time for decades. So why are so many still standing behind it? Joining us now is Mr. Troy, former Health and Human Services Deputy Secretary, currently a visiting senior fellow at the Hudson Institute. All right, Tevi, poll after poll after poll shows that the majority of voters, or at least half of them, right, want this law repealed. They're against it. And yet a lot of Democrats continue to stand up for it. Is it going to damage the president heading into 2012?
Oh, I think it's absolutely going to damage the president heading into 2012, Brian. I mean, that's pretty clear. The question is how much it will damage him. I mean, he has suffered a huge loss in this last election, 63 House seats and six seats in the Senate. And he's clearly a weaker president because of his efforts on health care. He's promised a lot of things, and he's delivered a big, confusing, expensive bill that doesn't do all the things he said it was going to do. So I think he's definitely in a weaker situation.
I want to get to the cost because this is a business program. And it's interesting because so many on the Democratic side will say this is going to help reduce our budget deficit. However, the CBO director's own blog says that the estimates could go up or down because they don't know how it'll be implemented. The Center for Medicaid and Medical Services actually shows that as of the end of 2019, the total cost increase will be $251 billion. What do you, I mean, is there any way this will cut the deficit? Because that seems to be the angle the Democrats are taking the most in defending it right now. But the CMS says no.
Yeah, I mean, in the president's defense, he was right to say our health care costs are going out of control and we need to do something about it. Unfortunately, the bill he put forward isn't going to do anything about it. It's going to increase our costs. And as for the Democrats, in the last campaign, they weren't even claiming that it's going to reduce costs because there was a memo from the Democratic Senatorial Committee saying, don't make that claim because we can't back it up. So it's clear that the bill's not going to save money.
Well,
it's going
to
to cost
be fair,
more money.
listen, Tevi,
to be fair, this issue.
The Democrats who defend health care using the deficit, right? And then they also say the Republicans are flip-flopping because if they want to repeal this law, it will then theoretically add to the deficit. They're using the CBO's own projections, right? But as I noted, the CBO director's own blog said back on March 17th of this year that basically we could be right or we could be really wrong because nobody knows.
Yeah, you're right about that, Brian. But the problem there is that the CBO blog says we don't know for sure. But the way the CBO scored the bill back in March said that it would be a cost saver. I think we've learned since then that it won't save as much money. But because the CBO has officially said when the bill passed that it will be a cost saver, any effort to repeal the bill will appear as a coster, meaning it will cost the government money to repeal an expensive bill. It's weird, but that's how Washington works.
Yeah, it's interesting. The CMS report, which came out in April of this year, by the way, lists a total cost increase over the next 10 years at $251 billion. Yes, they did reduce the cost for Medicare by $575 billion if Medicare cuts are actually enacted, but the total cost of coverage expected to rise by more than $800 billion. Tevi, listen, is there any way to add 30 million more people to health care and not spend?
No, of course not. If you're going to just put 30 million more people, 32 million, in fact, on the government rolls, then that is going to cost money. There are ways to expand access and save money, but that requires us to move more towards a value-driven healthcare system where people actually have incentives to find the best deals rather than being in a government program where the government pays for your costs.
You know, viewers tuning in right now might think they're watching a recorded program because they say, well, Brian, didn't you guys have this discussion just about this time last year? But here we are again toward the end of 2010 having the discussion again. Is health care going to be a major issue for the next couple of months?
Yeah, it clearly is. I mean, the Republicans are going to have some type of repeal effort in the next year. I think it's going to be a symbolic vote. It will pass the House probably, but not go anywhere in the Senate because it's a majority Democratic Senate. But the Republicans are going to work for the next 2 years to highlight the flaws of this bill so that they can build the case. That's the phrase I always hear from aides on the Hill. Build the case for repeal after a 2012 election where they hope they will get a Republican president.
You know, the president also basically, I mean, he's going to veto this thing anyway. Let's say they vote to repeal it, it passes the House, and let's say some Democrats are scared enough of what they saw in the midterms to agree to repeal it, right? It's unlikely, but for the sake of this argument, let's assume that. The president would veto it, correct?
Oh, absolutely. The president would not only veto this, but he would veto a lot of attempts to improve the law or to fix it or to change certain aspects of it, like, let's say, the individual mandate, which is obviously unpopular in the courts as well as with the public. If the Republicans vetoed that and found the votes in the Senate to do so, which I think is possible, President Obama would almost certainly veto a bill like that.
Tevi Troy, always a pleasure, sir. We'll see you in the new year. Thanks very much.
All right. Happy New Year.
All right. Happy New Year.